Hi, I'm Tonya Fuller, and the speech that I'm going to do is for the Hocking College Addiction Studies interns. We are going to address suicide and how it affects the counselor and how it affects the consumer that is receiving services. I think that the first thing I would like to start off with is that the leading cause of death among persons with substance use disorders is suicide. It's going to take a great counselor to be able to reach people that are suicidal and to be aware of the warning effects of suicide and how it can come and show through in different ways than someone just maybe crying out for help. There are silent measures that people sometimes go through that are warning signs, and as counselors we would all need to be aware, and as interns especially. It is true that people with substance use disorders are 10 times greater to commit suicide than other people with substance abuse disorders. A lot of people suffer with post-anxiety, like stress disorders, PTSD, as they have been possibly put through some type of sexual abuse or been a victim of domestic violence, or possibly even just have general depression. A lot of times we have found that depression is the onset of the beginning of people that have substance use disorders. So what I'd like to say is, to start things off, you would need to evaluate yourself as a counselor. What have you learned about yourself in your formative years that could affect how you may view someone who is suffering with a substance use disorder? Another thing would be to understand, your concerns about clients that have suicidal tendencies. How will that affect your work? Will there be a lot of that you take home with you that might weigh down on you? You need to know how to put it in its proper place and have it in its own compartment. Of course you want empathy and you want to care for your clients, but it's most important to make sure that you know how to handle this if this should arise. And also, it doesn't hurt to evaluate your own self and where you stand with suicide, and maybe family members that you know or friends that you know that may have suffered with suicidal thoughts or attempts themselves, or even, unfortunately, maybe they have followed through all the way with the act. That's why it's always important to be very direct as you are thinking about approaching someone that you feel could be suicidal. Get input from the client. Of course you want to view the visuals, the verbal communication, the physical communication, notice any changes, but it's okay as a counselor to be direct and to ask, are you thinking about killing yourself? Some people will tell you. It is okay to ask and try to generate as much information as you can to find out if a person is suicidal. If you get that verbal okay, you know what to do. You reach out for help, you get a supervisor, you get someone straight away. Don't let that person leave your site or leave your office. They're in danger. As stated by the Department for Mental Health and Substance Abuse, no evidence has been shown that asking a consumer if they are suicidal has led that person to actually commit suicide. So as odd as that may be, and as frightening as that may be to actually have to ask someone, are you thinking about killing yourself? Do not be afraid to do that, counselors and fellow interns. Please ask the question, be as direct as possible. Always take every suicidal attempt seriously. If someone has told you things are bad, I think I'm just going to kill myself. Or if you've had a past with someone who's said several times back and forth, I think I'm going to kill myself, or I just want to die, I just feel like ending it all. If you hear that, you take it seriously. Even if it's in conversation with someone you might be in treatment with for maybe 5 or 6 months, you always take suicide seriously. A lot of this happens when you get into conversations with your consumers, you'll find out that so many contributing factors, as we talked about before, PTSD, post-traumatic stress disorder, anxiety, depression, marital problems, legal problems, financial problems. All of these are things, are contributing factors that get someone to thinking about suicide because they already are at their lowest point. And then when you factor in drug and alcohol abuse with that, it becomes extremely dangerous. So as we realize once again that people with substance abuse are okay to approach, be sure to approach them as direct as you can. Are you thinking about killing yourself? Remember, there's no empirical evidence that has ever been shown that asking someone if they're suicidal has caused them to directly commit suicide. We want to make sure that we remember that people with substance abuse are 10 times more greater to die by suicide. This is something that is real. It happens. And there are a couple protective factors that we can go through. Other than just being direct and asking, we are able to try to set goals with the client to maintain sobriety, to see if they would be interested in joining a 12-step program, and to see if they would like to have any, we need to help them reach for some positive supports in the community, such as AA, NA, a religious choice if they practice a religion of any type. I think it is important to not be afraid to clarify the beliefs with the supervisor. Make sure you let the supervisor know immediately at any time that the person is suicidal. There are referrals that can be done to people that have mental health experience and training. If it's something outside of the scope of a substance abuse counselor, you can refer them to a mental health professional. Do not be afraid, as an intern, as a person that might have had 20 years of experience, wherever you may find yourself, do not be afraid to call for help. Do not be afraid to ask the supervisor. Do not be afraid that someone may think you're not experienced enough to handle the situation. Simply put, take suicidal threats seriously. Follow some of the great tools that we've been taught in our addiction studies courses, which is GATE, where we gather information, we access our supervision, we take responsible action, and we extend the action for addressing suicidal thoughts and behaviors in treatment. I think that it is just most important to take these threats seriously, reach out, and possibly save someone's life. There's a lot of power in that. It affects them and their future and so many family members and friends that care about them. And as a professional, I think that any of us that know that we have reached out to a person at their lowest point and possibly even saved their lives, I think it would give us a great sense of pride. So I would like to say thank you very much for listening to my speech, and I wish you all luck during your internships and your professional careers. And let's just remember the facts. They're 10% of all people that suffer with substance use disorders will commit suicide. Thank you for your time.